Good afternoon. I am Ivan, father of Yakov. Yesterday we had Strabismus surgery in Sveti Vid clinic in Belgrade. I would like to share our experiences with exam and surgery. We come from Rijeka in Croatia. When our Yakov was 3 years old, we noticed problem of turning left and right eyes toward inside. We didn't notice lazy eye and amblyopia because 3 years old child hardly can express how he sees. He's born that way and he thinks that's how it's supposed to be. We decided to go to examination in Rijeka, Croatia. The exam prescription was determined and he was given glasses. Advice was to wait and avoid surgery since he was 3 years old, to wait for time to solve the problem without surgery. As the time was passing, the problem became worse and the turning of the eye became worse and it was not going away. We were given information that child's vision is developing until the age of 8 and he was already 6. At that moment we decided to go for second opinion to Clinic Sveti Vid in Belgrade, as we were recommended by our friends whose girl was operated here and solved all of her eye problems. When we arrived to examination, we were told different diagnosis. We were given different approach to the problem. Diagnosis Strabismus high dioptry. We were told another diagnosis, amblyopia. We were prescribed occlusion therapy and exercises, advices from Professor Autrata how to approach this problem. After 4 months of exercises, according to instructions, we achieved great advance in sight quality of the weaker eye. Practically, we achieved in 4 months what we couldn't achieve previously in 2 years. After the sight was improved, he was ready for strabismus surgery on that weaker right eye that was turning inside. We decided to have surgery in Sveti Vid in Belgrade. The surgery was performed yesterday. Today he is playing with his brother. He has no problems. The surgery was perfect, without any difficulties, without problems. Surgery was done in general anesthesia, without any complications pre, during, and after surgery. We were given eye drops and ointment therapy for 1 month. First control today showed that surgery was successful and strabismus problem is solved. He will continue to wear glasses. His diopters could be further solved, but the greatest problem of strabismus is solved. He no longer sees double. He can start school normal in September. Professor Autrata operated my child Yakov, and it is really not easy to choose and decide whom to give your child's eye to operate. Professor Autrata is one of the most famous pediatric eye surgeons solving eye problems in children. It is hard to feel in the world confidence and trust as we found it here. As a parent, without any doubt or fear, I chose for my child to be operated here. And I can recommend it to everyone whose child has eye problems to come here and find help from experts over here.